and all that is happening. So we thought the sky was the limit.
We have 5 more minutes.
Five of my best learning courses. These are the 5 top learning courses.
We have 3 more minutes. Chief.
Hi, this is Sitalakshmi Shivakumar.
Mute your calls. Hi, everyone, please mute your calls. It will be very nice if you mute. So just I am playing a small video in which Amisha Patel has spoken about Emocare. Just I am sharing the video.
The best chain of mental health care and training provider in India. Many congratulations to you, sir.
We have been talking about Gadar, but one of the best thing Amisha Patel ma'am did, which I would like to bring to this kind audience. On her birthday, she has distributed sanitary pads and masks to people to spread the awareness. That is the first thing. The second thing, during the corona period, her tweet was very famous. She told that you can go around the world by sitting in the home, by reading the books, and she encouraged the youngsters to read books. That was one of the great aspects. Receiving the award from Amisha ma'am is really a good aspect. Ma'am, I am from mental health sector. Can you say a few aspects on the importance of mental health, ma'am?
I think if you have your mind in place, you have everything in place. That's one thing no amount of money or success can buy. And spreading mental health awareness is very important. People need to realize that having a mental ailment is not something one needs to be ashamed of, but one needs to address. And once you address, it is the beginning of a cure. So I'm very proud as well. Thank you. I know that during the pandemic, a lot of people have gone into various forms of mental health issues. And I think working towards that, that's okay. Thank you. You truly deserve the award. Thank you.
Thank you.
Okay, team. Now time is up. 88 people have joined. It's 5 o'clock. So thank you very much for joining, everyone. It's a very wonderful evening. So maybe Sunday quiet time, enjoying time. Okay. Even though we have so many works, seeing 90 people joining at 5 o'clock, really it is a very nice aspect. So yesterday we started the session. I think I have shared the PPT also. I think hope you might have gone through the PPT. The PPT which ma'am has shown, that also we will share it. Okay. So before going to today's session, okay, just I would like to ask you people, see, There may be people here from college, okay. There may be students here. Today we will be having a session for around 1 to 1 hour 50 to 1 hour 30 minutes. And we will really like to do something worth, okay. You are spending your time. One of the valuable aspects is time. Recently, I conducted a session of time management in Voltas. See, resources, there are 3 types of resources. Men, money, material. Money, if you lose, you can earn it again. Material, whatever happens, there is a chance of recovery. Men, the human resource. Human resource, we will be able to develop. We will be able to develop, suppose, unless and until someone has died. Other than that, it is recoverable. But time is the one aspect which cannot be recovered. So you people are spending your time here. So we would like to salute you for all those the people, because 94 people, that means 94 hours. Okay. So yesterday 94 hours and today 94 hours. Yesterday more than 94 because many people have seen the video. The video more than 600 people have seen so far. So we would like to address your concerns. Okay. So in this program, okay, what are the other things which you expect if you communicate now itself? Okay, which we will be able to give you in this 1 hour. So Rati ma'am has joined, Dr. Rati Chandana has joined, Dr. Vanita ma'am from New Delhi joined. Both of them are very seasoned psychologists, and they have because see, they themselves have completed doctorate. See, if I talk about case history, I am not submitted any thesis. Okay, so I am not doctor, but both of them are doctors. Dr. Rati Chandana and Dr. Vanita. So they have submitted their thesis, and Vanita ma'am actually she has worked in hospitals. So we are going to see so many aspects today. But before that, if you people tell me, what are the aspects which you would like to get knowledge into? What are the aspects which you want to know as far as the case history is concerned? Okay, that you can just open your mic and share it with me. I'm just opening the mic. Okay, I'm opening the mic. So these are the things also we would like to know as far as a case history is concerned. You people can just tell which Rati ma'am and Vanita ma'am will definitely they will be able to tell. So I want to become a life skill trainer, sir. Yeah, Siraj, if you want to become a life skill trainer, that is a very easy one. After the program, just please connect with me. Okay, connect with me. I have given my number. Okay, in the chat box. I have given my number in the chat box. You can just connect with me. Okay. Yeah. So Rati ma'am has given her number, given my number. Okay, you can just contact with
Your
me.
number, sir, I have posted. Yes.
Yeah. Ma'am has put the number. Okay. So anything which you would like to know about, particularly case history. So both of them will be able to see. It is just like I am telling. See, Shivakumar, Dr. Rati Chandana, Vanita, and Shivakumar. We are thinking that we are able to prepare biryani, very good biryani, mutton biryani, chicken biryani, all those biryani, and we are ready with the biryani. Okay, but the person who is going to eat is you. Whether the biryani is nice or the what is it you expected? Sir, actually I came thinking that we will be getting vegetable pulao, but you have given biryani means then everything goes wrong. So what you want that we should give. It is not what we have. Usually the thing should be that what the customer wants, what the client wants, that we have to give, isn't it? So we may be able to produce best of the best biryani in the world, okay? But if you are the person who wants a curd rice, okay, then we have to provide that also, no? So you can just tell how to write MSc. There are so many points to note, but not all might be applicable for all clients. Archana. Yeah, Archana, this point I will cover it, okay? During the aspects, even both of us will cover, and I will also give my own aspects. Okay. That also we will cover it. Anything else? Anything else, Steve? If you don't want to come on the audio, you can just put it in the. Yes, that is. See, 100% there is a difference. See, now disability and mental illness. That is, you have a vast kind of difference. That also we will try to give some kind of differences. We will try to put. I pursue Bachelor of Public Health. So, what is my further future? Shamindra, actually, we have some career counselors in Emocare. Okay. So, the numbers are given in the website gtcco.co.in. All the career counselor numbers are given and their email ID is also given. You can just get in touch with them, and I will also try to provide any aspect after the training program, because this is about case history. Difference in BSc psychology and difference in. Okay, this is one of the best questions. How that should I start? Actually, see, in India, actually, psychology has to be taken in the science stream, or psychology has to be taken in the art stream. There are confusion among universities also. For example, if you take Tamil Nadu, we have only BSc psychology. We don't have BS psychology. Whether it is in regular mode or even correspondence distance mode, Madras University, Tamil Nadu University, okay, Bharati Dasan University, Bharatiyar University, Mother Teresa University, Madurai Kamaraj University. All the universities, we have only BSc psychology. We don't have a BS psychology. BSc psychology and MA psychology.
Sir, if you give me an opportunity.
Yeah, I will finish it, Vanita. I will finish it. I will tell you. I will hand over the mic to Vanita ma'am. So in Tamil Nadu, we have only science stream. In other states, I think we have a BA psychology and also BSc psychology. I think mostly a BSc clinical psychology I have it, and a BA clinical psychology also. Always clinical psychology is a better option. It is a better option because clinical psychology, when you pass, you will be able to conduct assessments. Here we don't want to tell the scope and all, even though it is not related with case history. Okay, only this question ma'am will answer. Okay, Vanita ma'am will answer. Then we will go into the case history. There are other things which people have asked that we will give after the training program. After case history, definitely for all these questions we will give answer. For this question, Vanita ma'am has to say something. Yes, Vanita ma'am.
Thank you, sir. Friends, when we are talking about psychology as a subject, then very interesting is that in India, as sir has rightly said, that a little confusion between BSc and BA psychology, because psychology still is reeling under controversy whether it is a subject of humanities because it deals with human nature, or whether it is a subject of science because it deals with research. And of course, let me share with you, in northern part of India, we generally have BA psychology, part of humanities, but then that is material because the subject that will be, or the papers that you will be dealing with are more or less afraid of mathematics, because in northern India, we have statistics also as a subject.
Vanita ma'am? Vanita ma'am? Vanita ma'am, actually your voice is not coming properly. I think there is some...
Yes, there is a buffering, yes.
Okay. Vanita ma'am, let Anita ma'am, let Rati ma'am start the program. Okay ma'am. Then we can... meanwhile, you can check your connections, madam. Actually, the audio is not coming. So, Vanita ma'am will audio, checking the audio. So now, Dr. Rati ma'am will start the session. After Rati ma'am, Vanita ma'am will be talking about the practical aspects. Then we are going to see some case studies. Rati ma'am, over to you.
Thank you so much. A very good evening, everyone. Hope you're all excited again to have some insightful session from Emocare. And I'm again grateful to you all for sparing your time and being here well in time. This is a great thing. We are here 100 on Zoom and number of other viewers are there on other live platforms running as YouTube and LinkedIn. I'm grateful and thankful to you, all of you. And I salute you all that what you all are doing. This is actually a community thing, what we are doing. If you're working for the community, you are actually the leaders. Leadership is nothing but working on a common ground for the community, for the betterment of the community. And now, in the present scenario, after this COVID, everyone needs to learn this counseling, this life coaching, so that we can make our life beautiful and we can help others to make their life beautiful. So welcome all of you here. And I hope you must have, so can you make me the co-host, please?
Yeah, yes, ma'am. Yes, ma'am.
Thank you. We would be taking all your questions after the training program. Please keep your chats closed for some time so that it should not give any distraction. And Emocare is giving up programs for life coaching and all. Few of them, you are asking, we are all giving. And we would keep you posted for everything. And we would add you in our society, in our community. So please rest assured, we would take your each and every query post the training. I hope my screen is clear. I'll start it from a briefing. Is the screen clear? Is it visible?
Visible, ma'am.
Thank you so much.
Yes.
Now, when we started yesterday, just a brief reminder of yesterday, what we did, summary, that what you have to include. The first thing is the demographic in the patient's history, case history, present complaint, what he's going through, mental and the physical complaint, both you have to take care. The medical history of the psychic and the psychic history as well, the physical and the psychic, because I told you yesterday, all the physical disorders are related with mental disorders. Maybe one is affecting the other. So we should know what is the current problem my client is facing. So we need to know the drug history, what all drugs are being taken. Then is the family history, whether these problems were prevailing or are prevailing in the family. Maybe my just next generation, my father and mother is not having this problem, but maybe my grandparents were affected. So we need to know the family history. Then comes your social history, how and in what how is our social economic conditions. We need to understand how much we are smoking or on alcohol. What is the level of my intake? We need to understand that. And then the personal history. Personal history will start right from your birth, the city of birth, then your education till the last education, what you did and where was your job or what you are into. Is it business? Is it job? What all things, your relationship, your family, everything, your friend circle, how do you spend your time? Everything will come under personal history. Just keep yourself as a client and understand what all is there. What all do you like? Sometimes, you know, when you ask what all colognes do you like, what all perfumes do you like? Some people have got allergy to perfume. No, I don't like perfume. You'll come to know how do they react and respond. Forensic history, if some client has been under all these things, do ask certain questions, but ask in a sensible manner so that they should not feel bad. How do they react and respond to the current situation? You need to understand the pre-morbid personalities. Then next, mental state examination. How is their current state of mind? What do they think? How do they think? What is their appearance? How do they talk about it? How is their concentration level? This is just the briefing. Then I gave you the complete questionnaire. Again, these all details cannot be taken in one go. So we have to break it into small sections where we could develop the more rapport between us and our client, and we could take more history. Why would someone tell about us, themselves? No one wants to like to tell about their negativities, their problems. They only tell, they only disclose if they feel that, yes, the person is trustworthy. The belief is formed. So break down. Don't be in a hurry to fill your files immediately. No, you have to break down. Maybe your performer could be of 17 pages or of 5 pages, but don't make it into a hurry that I should have all the information in the one go. No. I have seen people telling them that they are single, they haven't done marriage, but in the third sitting, they told that yes, they got married, but it was not a good relationship. So within 6 months, they got separated. So you will come to know so many things. You know, it's like unpeeling of onion, one after the other layer. So do it slowly and steadily. So it should not harm the emotions, because already when you are having some client with you, they have come to you because they are not in their good mental condition. So being into this field, you have to be patient and you have to be a good listener and an observant. You have to observe when your client is responding to you, the body language, the way if they are writing your questions, how they are writing. Psychiatric systematic inquiry, as I told you, there is no systematic inquiry. Every person follows their own USB. Every person. Maybe my system, there is a format, but maybe my system of asking the questions are different and your could be different, on analyzing of some third person is different. Maybe if I crack a joke, I could make out certain things I need not to ask. And if maybe you are discussing some, I've seen some seniors, even they discuss the movies, you know, the sports. If they ask you like sports, yes, I like cricket. They start discussing about the World Cup, the cricket things and all, and they come to know that how the person responds. So there is always, you should have your own unique system, USB. How do you take out the history? Mood disorders, we were on the last topic yesterday, the depression. What all questions? I gave you the questions, what all questions you can ask for depression. This is a list of certain questions, because questions help you to dig out. You have to dig in till the time you reach the root level. There is a difference between a counseling and a coaching. This is the only difference, that in coaching, we don't go to the root level, but we go from the present to the future. But in counseling, we have to go. Shamli Mitra, please stop doing this. But, sorry, in counseling, we have to dig in. Where is the last root? Where from the root is arising? So your reach has to be till the root level. So you have to ask certain questions. Depression we did yesterday. What's your concentration? How to think? Now, next time moving forward is the next level of depression is the suicidal and deliberate self-harm. This is very common nowadays. You might have seen people that they harm themselves. What questions you can ask? Have you ever felt so low that you have harmed yourself in any way? Do you ever feel so low that you felt that your life is not worth living? That yes. Can you realize yesterday I told you, keep yourself there. Ask these questions to yourself. People have guilt in their mind. They have low self-esteem. If you'll ask certain questions, you'll get to realize what is going through into their mind. Have things seemed so bad that you have felt like ended it all? What has been so worst or so ill that they felt like, you know, finishing their life? Aisa kya ho gaya? A life is being given by the Almighty. We have got this life. It is not everyone, you know, it's not, we get it after kitna tapasya ke baad, after so many years. What is that thing that is hurting a lot that we thought of ending up this life? Have you ever thought about ways that you might kill yourself? Do you think you would ever carry out these plans? They might tell that 2 years before I had these things into my mind. When I was pregnant, I had we'll find such patients, some clients, they'll say, yes, when I was pregnant, I had certain things in my mind. I was not happy with my family, in my relationship. And I was like, let me finish my life with the child itself. But now at present, the child is 2 years of age. So you need to analyze with the set of questions what you're asking and the answers what you're getting. That is those same thoughts arising into the client's mind, or it's gone. It can feel really difficult to ask questions about suicide. There is no evidence that asking about suicide increases the likelihood of a patient carrying it out. It can sometimes really help a patient to talk about the suicidal thoughts. Actually, it's the truth. When a person admits that, yes, I want to suicide, sometimes only your talk can heal them. So don't be hesitant. If you're into this field, please don't be hesitant in asking certain questions. Maybe it's related to sex. Maybe it's related to any disorder. You need to ask. You need to ask, whatever is your age. Age is just a number. But the time, just think that you're taking the history to treat, to help someone. Because your first motive should be to help someone. And if you'll start doing it, start living it in this way, helping someone, money is a byproduct you will get. So don't be hesitant in asking the questions which are related to suicides. Elation, how the person feels. Have you felt that your mood is better, higher than usual recently? Have you felt more cheerful than usual lately? So you have to ask, let the client compare. When they have felt their mood is good, when they feel elated, when they feel like enjoying. How are your energy levels at the moment? How do they feel when they are at good? See, I have bold the words mood, energy. Do you find you are being more active than usual? You have to show them the difference visually, that when your mood was good, what was your energy? Suppose if I teach you like this, how are your energy levels at the moment? Do you find you are being more active than usual? See, you have to keep your energy high. If I do this, will this class be, will you pay more attention to me? No. So your energy has to be high. The same way you have to ask them, how is your energy when your mood was good? Is it hard for you to relax? Maybe the person might have feel good when they have watched a movie. Maybe if they have played with a pet, they would have felt good. If they have gone to the gym, they might have felt good. What was that which gave them elation in their mood? What was the energy? Do you feel able to achieve more than usual in a day? See, today I'm in a high energy while I'm sleeping. So how I will get up? I would get up with higher energy. If my energy was high at the sleeping time, I would get up with a higher energy. So these are the questions which you can make them realize. How is your sleep? Have you ever been sleeping less than usual? Do you find you are burning the candle at both ends? Yes, here. What's going through? Ask. Your questions should be to the point. Satik, it should hit here. It should connect here. When your questions would connect, they would tell you everything. The lids of their life would be opened, and with one or two questions only, they'll come out everything. It would be like vomiting, and you have to just keep jotting what they are telling. How is your concentration at the moment? Are you able to read a magazine, read a newspaper, watch a TV program? Can you do this without your mind wandering? Sometimes we are just watching the TV. Are we actually watching? Are those people actually watching, or are we actually watching? We need to check. So again, questions does matter. These are just the sample questions I'm giving you, which would help you out to treat a client. Do you feel as if your thoughts are racing? Do you find your thoughts are coming faster than usual? Do you find you are having lots of good ideas at the moment? Sometimes it happens if they feel that, yes, when they feel elated, they get something to do in their mind. I have to do this. I have to join this course. The energy is high. But what is the next step? I have to join the course. I have to get the books. I have to order this. I have to order that. How do they feel? When you'll ask such questions, I am very sure that you will see the excitement in the client. You will be able to have a good writing history. Delusion. Now, what is delusion? You all might be knowing delusion is a false, unshakable idea or belief which is out of keeping with the patient's educational, cultural, and social background. It is held with extraordinary conviction and subjective certainty. You know, you have seen how do they feel deluded? Kuch chal raha hai. It's their belief system, delusions. The patient will not usually recognize their delusional thoughts to be a feature of their illness, and so it's not usually possible to ask. Because you cannot ask them, have you been in unusual thoughts? For example, get an informative answer. They won't give you because they have their belief system. You have to make it out. Often the patient's delusional beliefs became apparent over the natural course of the psychiatric case history, but it's good practice to start with a couple of open questions. Now I'll give you the list, tell you the open questions. Is there anything particularly on your mind? Has anything strange or unusual happened to you recently? What is the delusional thing? They think about me like that. They have a belief. My husband doesn't love me, or my wife doesn't respect me. This is their belief. This is the open question what you can ask. Very open question, and you'll get very open answer. Because they want that someone should ask them this open question so that we could answer. Ghuma fira ke nahi, direct question this. Otherwise, do you ever feel that people are talking about you behind your back? Again, this is a delusion because it's my belief system. They think about me like this. My siblings talk about me like this. They don't like me. They are jealous of me because I'm at a good position. They have that feeling. Do you feel that people are watching you? Sometimes we have that, they have that, or even we have that as a regular person also. Yeah, whatever I do now, I think they have an eye on me. Do you ever feel that people are trying to harm you? Do you think there is a conspiracy against you? Choti choti cheezein, small things, sometimes they keep it in their mind. So these are the questions that would help you out. So I've given you what is a performer. You can always follow any prescribed formula. These are all the questions which would help you out to get the correct answers. These are all those questions. Now, delusions of reference. This is something which which very rare people would tell you. Very rare people. But why I've added this? Because of my experience and what my guru has taught me. Do you ever feel that the television or radio has specific messages for you only? You know, what is this? This is a major thing with the teenagers now, especially. Teenagers or even in the 20s that they have. Sometimes they listen to some song and they keep it like that this song is for me. This song is meant for me. This movie is on my life. It is their belief system. Do you feel that they are speaking only to you? You have to ask them. Do you see any reference to yourself in the TV or newspapers? Can you relate this? Aisa hota hai na? Nowadays, they are feeling it. That yes, this is for me. This movie is on my life. Arey, what is your life here? You are just 20. Did that director or producer came to you to have your story? No. But they have that belief system. They all realize. Not even they all realize it. Mera jeevan kora kagaj kora hi reh gaya. Sometimes the person who has got into, breakup, they'll sing that song. Now, recently, like Sidhu Moosewala has passed away. So his one song, 29/5, every child, it's booming up. You see the views on YouTube, how it is growing. Everyone is watching. So it happens. They take it as if the TV mein ad aa raha hai, the ad is coming on the television, or this movie is there, or this song is there, it is for me. They are telling me something, or one thing is that is for me. Second thing is they are telling me something. They are pointing at me. This is also a problem. They are pointing at me that you are like this. So this will also be a cause which would help you. Then hallucinations. Can you make a difference between hallucination and your delusion? Delusion is a belief. Hallucination, they think that it is a sensory perception. Somebody is coming and telling me into my ears. I was sleeping. Someone came and someone told that you are of no use. Delusion is a belief that yes, I had a thought, I made it, yes, it is that right. But hallucination is sometimes like someone is standing behind me. Or even if their loved one have passed, sometimes they'll say, no, that I could see my father. My father came and talked to me. They stand here when I'm in my room, when I study, my father comes, my mother comes. This is hallucination, what they get. A hallucination is a perception in the absence of an external stimulus. They are subjectively indistinguishable from a normal stimulus and can occur in any modality. किसी भी तरीके से. Do you hear the voice through your ears or inside your head? Something is going into my head with some voices. Auditory works here. Are they as clear as me talking to you now? You have to ask them. Okay, you say that your father died, passed away, and he's talking to you. He came and talked to you. Was the voice as clear as I'm talking to you now? You have to ask them as a psychologist, as a counselor. What did they say? Or what do they say? Kya bolte ho? Do they ask you, how are you? Or do they ask you that I want to take you along? If you'll do them cross-questioning, then you'll get better answers. How many voices do you hear? Does the voice talk to you or about you? Do they comment on what you are doing? So when you'll ask certain questions, they'll be able to make out that actually it is hallucination or it is something going into their mind, which is what is troubling them. Because at last you have to empower the client to come out of that condition in which the person has come or the person is looking for the solution. Anxiety. My last topic is anxiety. Anxiety examples. See, anxiety could be in any way. Symptoms of anxiety can be slipped into physical, emotional, cognitive, behavioral. It's good to start with some open questions again. The sample of open questions I'll give you again. How do you feel physically when you are feeling anxious? Very common questions. How do you feel physically? This is the first question which you can ask. Because definitely when they have anxiety, they might feel something in their hands, their legs might be shaking, their hands might be shaking, they might feel sweat, whatever, shaking hands or something. Do you feel short of breath, heart racing, butterflies in your stomach, sweaty palms, dry mouth, shaky? Basic questions, you might be aware of it. What kind of things are on your mind? When you are getting all these things, what is running into your mind? Oh, my hands are shaking, or you're thinking about something else. What do you worry about? What is that giving you the anxiety? What do you worry about? You know, when this COVID happens this year, I have seen patients dying because of what? Just because of the worry, not because of COVID. No. The people who survived were the ones who had a very good, mental mind with them. Mental status was high. Even I have seen people surviving of 75 years and 80 years of age, but the people who died were of 50s and in 40s. Why? Because they were only worrying about who will take care of my shop, oh, my office, my family, my friends, because that worries took their life. Are you able to distract yourself from your worries? Are you able to come out of it? You have to ask them. Are you able to let them go? For obsessive thoughts, do you find unpleasant thoughts into your head when you don't want them to? Do you find these thoughts and are you able to come out of it if you don't want? Or when you think that I don't have to think all these things, still you are getting it. Behavioral symptoms when they have anxiety. Is there anything you avoid doing because of your anxiety? Do you avoid talking to your kids? Do you avoid taking your classes? Do you avoid your regular things? Do you avoid cooking? Do you avoid driving when you are into anxiety? What impact does your anxiety have on your life? Because here you will come to know the level of anxiety, how it is affecting the client. Panic attacks, very common things happening now with kids also. Have you ever had a solution where you were overwhelmed with fear, had a racing heart and difficulty in breathing? First question, what was it like? How was it? You have to ask them. Let them describe themselves. What was the physical condition? What was their mental conditions? What were your thoughts? Again, what they were thinking. How often do you have these episodes? How often do you get these panic attacks? Maybe once a month, maybe once a week, maybe once a day. How often? And is there any trigger to these episodes? What is the cause? What leads you to have this panic attack? I hope these sample questions and my telling you how to write your case history, might have given you some information. See, coming over to my second slide, I'll come. What I'll give you again the reminder, though I'll share it. This case, the case you are dealing is the real life situation. The case study is the analysis of the situation. Do your analysis in such a way so that anyone would be able to give the solution to that person. What for the person has come, you have to do the overview. Then you have to check the challenges. What all are the challenges? Then the solutions, and then the outcome. How you implement the solutions with which we get the outcome, the results. Because our main aim is to give them the solution. Thank you so much. I hope this might have helped you and given you a brief description of how can you make your case history of the client. Over to you, sir. Thank you so much.
Very wonderful, ma'am. Wonderful.
Thank you so much.
It was very wonderful. Vanita ma'am. Vanita ma'am.
Ji, sir. Am I audible now?
Ma'am, you are audible, ma'am. There is no need to come on the video. I think because when you are in the video, ma'am, actually the voice may not be able to come. Now, change. Vanita ma'am will say the practical aspects. See, one is suppose when I want to write a case history, what are the different aspects that we have seen? We are going to see some practical aspects also. Now, in the practical level, okay, what are the difficulties may come? Okay. Suppose if I am a college student, okay, so how that what are the different problems may come, how to write, what is the very important aspect? See, now ma'am has explained everything. One question to every one of you before handing over to Vanita. Okay, for writing case history, okay, what is the very, very important skill which you require? Please put it in the chat box. Please put it in the chat box. For writing case history, what is the very important, topmost, the first one, the topmost skill which you require? What is it?
The chat is disabled.
Observation.
Yeah, please put it in the chat box.
So chat is disabled.
Chat is disabled, sir.
Yeah, 1 minute. I will open it. Yeah,
Asking questions.
yeah, please put it in the chat box. Let me see. What is the, for writing a case history, what is the very, very important skill which you require? Observation, asking questions, building rapport. Okay, rapport building, observation, to develop trust. Okay, analysis, right question, observation skills, asking questions. Okay, yeah, please, empathy, listening, empathy, observation. Okay, yeah, building rapport, soft skills. Yeah, then what else? Trust, listening, rapport building. What else? What else? Observation, trust, eye contact. Okay, yeah. Anything else? Anything else? Interview skills. Okay, not all these things. Whatever you have said, it is not done. No. These are the secondary aspects. What is the one skill? Again, I repeat you. Okay, again I repeat. To write the case history, what is the important skill which you require? Okay, and whatever you have said, it is not done. The topmost skill which you have. Nobody has. Okay, and now someone has written. The skill, one skill which you require is you should have a written capability, written skill. See, English you can talk. Okay, you can ask questions. You have to write it. For example, the history of the client. Okay. For example, history of the presenting client. This you have to write it in third person. You have to write it in the third person. for which you need written skills. You may be able to connect with the client. You may be able to create empathy. You may be able to do all the things. If you are not able to write it on the paper, if you are not having English writing skills, because case history, you are not going to write it in Tamil. Okay. Maybe in majority of the hospitals, you are not going to write it in Hindi. Are you going to write it in Hindi? No. So you will be writing in English. When you are writing in English, how many of us, okay, we are very, very good in written English. Most of the people, we don't concentrate on that area. Most of the people. I went to a lawyer actually. Okay, I went to a lawyer. I wanted to give a lawyer notice. He told, okay, Shukmar, what is the problem? Okay, I told all my problem. He told, Shukmar, as per this act, as per this act, this act, it is wrong. Okay, I will write the legal letter, Shukmar, you come and collect tomorrow. So what is the charge, sir? 5,000 rupees. Okay, sir. The next day I went. Okay, I just got the letter from him and started reading. Okay, I felt like vomiting. The English was such a worst English. Okay, if somebody receives the letter, the client receives, when the advocate receives, he will just throw it in the dustbin. Good for nothing. He doesn't know how to write English. Okay, good for nothing. He will throw it on the dustbin. It is not your oral skills. You may be very good in oral skill. You may be very good in empathy. You may be very good in eliciting things. You may be very good even in treatment. But case history, it is handwritten. It is handwritten. First, you will be writing in the hand. Or suppose even if you are having computer, okay, even if you are having computer, you have to put it. Whatever you are putting, it will analyze. It cannot just like that. See what is in your head and it cannot write. Isn't it? Particularly in exams. Particularly when you are submitting a project report to the college. Can you say, no, I have written in the Excel format, I will give you. You have to submit a project, isn't it? Written skills are one of the topmost skills. One of the topmost skills. Particularly that has to be written in the third person singular. So today shall we do some kind of practical aspects? Shall we do? As far as case history is concerned, I will give you the case study. I want you people to write here itself. Let us see how far we are able to write. Is it okay? Okay, not okay?
Yes, sir.
Okay,
Yes,
okay.
sir. Okay.
Okay. Yeah, very nice. Now, 15 minutes, Dr. Vanitha ma'am will answer your queries, practical aspects. Then after 15 minutes, I will take you through the question. You can ask the query and she will answer. Ma'am, you were telling something about the BA
Right.
psychology.
Sir, now, sir. Now with my video on, am I audible enough? Or shall I switch off my video? Good.
Madam, it is audible. It is very much audible.
Yeah, thank you. Good evening, friends. Sorry that my device was not working well and I've changed the device. And I hope I am audible to all of you. We were talking about the difference between BA, that is graduation. BA is bachelor's, means undergraduate studies. Undergraduate studies is a degree, 3 years degree in India. So when we were talking about psychology in particular, whether we'll get BSc degree or BA degree, friends, let me tell you, it really does not matter much, because psychology is still struggling with whether it's a part of science or whether it's a part of humanities. Why? Why humanities? Because it deals with human behavior, human nature. And the scientific part is basically dependent on that it's a research-based program. It's a research-based subject. A lot of anatomy, physiology, because nervous system and other things are covered in this, plus some part of statistics is also covered in this undergraduate level. So you don't have to worry, because the syllabus has been structured in such a manner that it will cover all the important aspects. Unfortunately, in India, the situation is very grim, because the subject, though UGC looks after the whole structuring, yet again, the papers can be different for different regions. Let me tell you one simple example that I belong to Delhi, and I have done, as Sir has already said, I have done my doctorate from University of Delhi 30 years back, right? And when we were doing psychology honors is primarily, now many universities is offering honors. Now this is for the students that if you're thinking about a career in psychology, you must do honors, which means I did 5 to 7 papers for all 3 years, which means, whereas a friend of mine who had done from Punjab University has done 3 papers in her undergraduate level in psychology. So you can understand the comprehensiveness of the knowledge that a person who does honors has as compared to a person who does a BA program with psychology as one subject. Then we carry on to the next level, that is MA psychology, where of course nowadays entrance and other things have become very important. So if at all you are concerned about picking up your profession as a psychologist, you must see the comprehensibility of the syllabus. That's all I have to say as far as BSc is concerned. Don't worry about that, because in any case, coming back to, I'm sorry to say, a very small thing, undergraduate degree is now actually become a very speck of the thing. You have to carry or study more. You have to cover more aspects. You have to gradually, as Sir has very rightly said, go in for MPhil clinical psychology. We have 2 colleges in India, specifically NIMHANS, Bangalore, and Ranchi Medical College. They give these 2 degrees. For anything else, I am available. Can we go to the next question now?
Yeah, any question, practical question you can ask. We have 10 more minutes. 10 more minutes, practical aspects, whatever thing you have doubts, she will clarify, because she has done it.
The second question somebody had asked before they write a question here or ask the question. The very important thing somebody was asking, how to frame and how to do MSc, that is mental status exam.
Vanita ma'am, the career related courses we will see it in the next program. Now I have a question about case history, ma'am. Let us concentrate on the case history.
Ji, sir.
Your question on the case history. Now I am asking a question on case history to ma'am. Ma'am, you might have taken many, you might have written many case histories, ma'am, in your life, because you have been working in hospital also. So what are the challenges you have faced, ma'am?
Very beautiful. So first challenge that we generally feel is the rapport building, because when we talk about hospital setting, many a times we have to see there are 3 categories, or rather I am defining into 3 categories, but there can be more categories. One is so-called normal people who come with very minor complaints, as Rati ma'am has rightly said, anxiety, maybe a child is not able to perform very well. Second is neurotics. Again, it's a very technical terminology that I'm using. Neurotics means that I have sleeplessness, high anxiety, panic attacks, etc. And third is psychotic. When we talk of psychotics, where they don't have, we were talking about, Rati ma'am has already shared about hallucinations, delusions, which is characteristic part of schizophrenia or paranoids. That is very difficult for a student to understand. And then rather than taking the case study, I always say, we always tell the caretaker, the informant, that we should start with medical history and we should immediately meet the psychiatrist before the case history is also done, so that a small amount of medication is given to the patient and now the client becomes patient. In first category, the person who comes for taking counseling is client. Then comes, okay, I am again a client or a patient, and in the third category we call that client a patient because is being put on medication. That's one challenge. Second is when a very small child comes as a patient, as a client. And third, of course, is when there are people from different backgrounds. You have beautifully put that writing skills, and there should be questioning skills, because the language should match. When I was working in hospital, most of the people would come down from all parts of northern India, and the dialect even in Hindi was very different, and the way they would explain the things had to be interpreted in a very different manner. If you understand, sir, the case study is always dependent on not only the analysis but the inferences and the treatment method that we will be using later on. So these are the language can be a barrier. Then of course sometimes the cultural background can be a barrier, where there is a person who's probably does not the psychologist or the social worker who's taking case history does not know much about that cultural background, and sometimes the precipitating causes, which we will discuss maybe sometime later, the precipitating causes actually start from maybe one of the I'll say celebrations of some local festival, and then that is interpreted as ki koi bhoot aa gaya, jhade pe le jate hain, all those kind of. So these again we have to explain. Though some neighbors, somebody is little more educated, they bring the client or the client's family, yet again reaching to the same level to understand the cultural differences and to elicit the information and then transform it into the inference and technical things becomes little difficult, specifically in India, because India has a lot of diversity. Yet again, case history is only one tool which unites all and quantifies and brings them to the common level.
Vanitha, ma'am, one more question, ma'am. Ma'am, at this case history and all, you might have written many case histories, etc. What is the role it plays in your Viva? Because when students go to in the college, they may be having Viva and all. So mostly the case history and case studies only they will ask. Team case study and case history both are different. But case history, based on case history, they will ask questions. The faculties will ask questions. So, what is the role, man? Suppose when I'm writing case history, suppose I'm writing case history, what are the fundamentals that a student should see? Fundamental.
So the fundamentals is first, of course, is very important is the demographic information. Then the format should be, of course, we'll be using many formats, but we should know what are the main 4 to 5 components that each case history should have. Plus, no student should use any word, any technical jargon as we put it, so that when I am reading, suppose, sir, you are the student and I am your teacher and I am reading the case history, and if I find something very technical and I happen to ask you, and if you are not prepared, you don't know, you have just copied it down. So the honesty, the integrity with which the work has been written, has been done, each of the students should know what they are writing, and if caught, if asked, they should be able to explain. Let's say there's a very common word which in when we talk of mental status examination, and that is insight or judgment. Or we were talking about, Rati ma'am was talking about delusions of reference or hallucinations. These are technical words which we, if at all we are writing, if at all our patient is giving some kind of information, we must read more about it so that we are not caught on the wrong footing when the Viva is being conducted. So we should avoid all these kind of reports. I have myself seen, sir, that many children, they like writing big words, confusing language. So one, it should be very clearly written, very crisp and to the point. And secondly, we should avoid very confusing language and technical jargons.
Super, ma'am. Super, ma'am. In actually soft skill, we used to tell, ma'am, any writing, it should be, we used to tell the students to keep one thing in mind, KISS. K-I-S-S. Keep it so simple. Keep it so simple. What you say is 100% correct, ma'am. Even in interviews, okay, people will just copy the objective and paste it in the resume, okay. Now they would have written, in one interview, I was an interviewer.
Sir, we lost your voice.
I think sir might have lost the connection. So
Connection.
yes, ma'am, you can continue with your experiences as you were telling. You please tell. I'll ask you a question. That as I told that in how much time they can take to fill up this case history. Please give your insightful
So beautiful.
experience
You've already,
as you have
yeah.
worked in the hospitals.
Thank you, Rati ma'am. You've already said a very beautiful thing that it may be 7 pages or 17 pages. We may, as I told you, it depends from person to person, case to case, and everything has to be tailor-made. We may have a proper format, but we must tailor-made the case history format as well. Because when we talk about a person, I'll share a very interesting thing. I was there was a family which came to visit me. The patient, the client, was in a very bad state of mind, but yet again I had to extract some history to give them some guidance. So it was my own patient, and I was working in my room, and I told the family member to take the patient outside and wait in the foyer. Interestingly, because the patient was very restless, they went outside, and you will not believe, she jumped onto the roof of the car they had come in and started shouting and dancing, and the whole colony came. In the meanwhile, I was talking to the parent and said, look, though I have understood whatever has happened, I gave them some instance, but I said, quickly, now it was around 6:30 in the evening, it was winter time. I told them, I am not the right person. Quickly take the child, in this case, I'll say client, patient, whatever, to the hospital immediately, as we were discussing yesterday. There was no time to take case history. I just took the major thing. I said, it is difficult. And I told them to go to emergency ward of the government hospital. That was GB Pant was nearby. I told them, take the person, because she needs little medication or maybe an injection. Once she settles down, I called them after 3 days again. Why? You'll not believe, friends. After 3 days, this girl was so sober, because it was reactive depression she had displayed. She was so sober. She came and sat down, and now she recognized me and she gave me a hug. And then we started talking about what went wrong. She was doing B.Ed, and after, I'll say, working on this case, it took me 2 months, and she was able to give her exams without any help. So it actually is very important that we see the situation, we see the age, we see the need of the hour, and then immediately tell the informant or the people who are accompanying, that it could be neighbors in some cases, it could be wife in some cases, what should be done immediately. And if the person is in the mode to speak, then we take a proper case study. Yet again, I'll just say one more sentence, that even though we will take probably in half an hour to 45 minutes to complete, I always say, never send your client without a little homework. Because many people, they say, case study aaj kiya hai humne, hum kal se kaam shuru karenge. I say, no, they'll not come back to you. They're your client. Give them a little takeaway. Give them a little takeaway.
They should not go with bare hands. Something should be given.
Something should be given.
They should feel that my purpose of coming has been solved.
And that is the major part of rapport formation. Now, and the last sentence we always say, मेरे साथ ठीक लग रहा है, आप कल आओ, मतलब फिर आओगे मेरे से बात करने? Will we carry on this? Would you like to? Because it is mutual. If I may be very professional, but the other person should also have a little liking, or trust of course will develop, but little liking for me कि हाँ मैम, अब मेरे को अच्छा लगा, मैं आपसे मिलने आऊंगा. You know, that is very important.
Thank you so much. This is actually the experience what Bam has shared, because she is a very experienced and senior psychologist. Thank you so much, ma'am. Over to you, sir. Over to you, sir. Thank you.
Rati, actually, when ma'am was talking, actually, I was remembering the last scene of Munna Bhai MBBS.
Yes.
In Munna Bhai MBBS, he will be telling, "Arey, kal koi ladka pee ke aayega, उससे पाम भरवाने के लिए मत देना."
Exactly.
मतलब करो करके उसको नहीं मरवाना है, उसको पहले जाके ट्रीटमेंट करो. मुन्ना भाई MBBS में जो है,
exactly. Yes.
Somebody is coming. अरे पाम पे लग करो पहले, लाइन में खड़ा रहो. Form fill up done. Oh, isn't it? That was it. Vanita ma'am, just I'm showing one case history, and Vanita ma'am and Rati ma'am also can give their own input. Tim, I'm going to give you some practical aspects. Okay, practical. One is the normal one. I'm opening the chat box. 1 minute. Okay. So, 1 minute. Okay. So let us try to do some kind of homework now. Okay. Some kind of homework. So the thing is, one is the actual case history taking. The case history taking, the demographical aspect, etc. It will be like this. So I'm just showing it. Okay. So for example, here the case history format. Okay. So name is Mary. See, we have deliberately did some mistake here. I'm going to show you some 3 case studies. Okay, dear. We have deliberately left something, and we are going to ask what it is. Okay. If anybody is telling the answer correctly, okay, they will get into my NLP program, which we are going to plan free of cost. Okay. So see all the things. Let me see who guesses it correctly. Okay. I'm going to present the 3 case studies. Okay. There may be a mistake. There may be things which is left out in some of the aspects, or may not. Okay. Let me see who is able to guess it. Okay. Yeah. So here the demographic details: Mary, age 48, gender female, native place Chennai, then place of living we will be taking, then residential address, educational qualification. Educational qualification must, because it may help us to understand what level of psychoeducation I can give. Suppose somebody is BA economics and somebody is MSc psychology already. So the way in which you will give psychoeducation differs. So case history is what is that you are doing, that you are putting it in the paper. It is not that what I'm going to do, which I am going to put in paper. No. Whatever I did it, that I will be putting it sometimes. So understanding the educational qualification, it has many purposes. Then language known. Language known to speak and to write. To speak, if you come to know, that's okay. If they know Hindi, suppose somebody is from Tamil Nadu, if they know Hindi, then it is very nice. Suppose if you are also from Northern Belt, you can start talking in Hindi. You will be, both of you will be having a what do you call it? You will be able to create rapport very easily. So religion is very, very important because sometimes the faith healing works more. Okay, whatever you do, faith healing has its own impact, isn't it? So understanding the religion always it is best. Then religious sentiment. Religious sentiment. This is what I am asking. What I am showing is for counseling. Okay, normal counseling. Okay, it is not clinical aspects. Normal counseling, somebody is coming, postmarital counseling or some of the aspects. These are the questions may help you to understand more about how you can handle the client. So again, I am not using the word subject here, okay? Because Munna bhai MBBS ne bola hai, subject ka word use nahi karna. Client, okay? So occupation, HR manager, income, number of siblings, birth order. Birth order also it is very important to understand various aspects. Then source of information, place of referral, veg or non-veg, marital status. Okay, marital status, it is very, very important. Sometimes if you are not getting married, that itself may be the problem. Sometimes you are getting married, that itself may be a problem. Okay, so you may not know what is the problem, isn't it? So marital status, occupation of a spouse. Okay, that is very, very important. Because from that also you can guess many aspects. So occupation of mother-in-law, occupation of father-in-law, okay, number of children, is it normal delivery or cesarean, client stays with whom, position of the client in the family, okay, then medical history, weight 5.7, height, weight, are you obese? When did you last do your master health checkup or blood test? Okay, do you have thyroid problem? These are the aspects, very important question, whether even in normal counseling. Somebody is coming for a normal counseling, when I am trying to take the case history, these are the very important questions. If somebody is having a thyroid problem, and if they are telling that they are having stress, the first thing is they should go to the doctor, first again take the thyroid test and start taking tablet, then come for counseling. Because thyroid itself will create stress. PCOD has its own troubles, isn't it? So, are you diabetic? Do you have high cholesterol? Because if you are having high cholesterol, definitely you may be having your blood pressure. And if you are having high blood pressure, that result, please mute your calls. Please mute your calls. Ahmed, please mute your call. Please mute your calls. It is a request. Okay. So, high BP, if somebody is having high BP, okay, then whether they are taking tablets. See, these all are having practical aspects. Someone came to me for counseling, okay, they told that he is aggressive personality. So I think he's an aggressive personality. That is what the wife told. And the wife told, sir, my husband he himself will agree that he is aggressive personality. I asked him, do you agree with that? She said, there is no other go. When wife says, can you disagree? Is there any chance? When a wife says to the husband, you are an aggressive personality, is the husband, whether the husband will have any chance of replying no? Is there any chance? No chance. Okay. He said yes. Then when I was asking about his blood pressure and all, he was having 150/90. What is the normal blood pressure T? What is the normal BP?
120/80.
Yeah. So he was having 150/90 high BP. Okay. Then definitely he will be getting anger. The BP may this will create that, and that will increase the BP. Both will be playing a simultaneous role, isn't it? So understanding these aspects are really very helpful. Then I will go quickly. Then how much physically fit you are? Okay. So she said she's having PCOD, past surgical history. Okay. Anyone in the family suffering from any kind of mental disorder or physical disorder? What is the last visit for psychological illness and with whom? If they say last visit to psychological illness is so and so doctor, and if they say, immediately we have to look up at all those aspects, and if required we have to send them back to the same doctor if required in exceptional cases. Then social history, smoking, whether smoking is there, alcohol abuse, drug abuse, etc. Okay. Then what Arshana ma'am asked it, that mini mental state examination. Mini mental state examination, sometimes you may not be able to take immediately. When you get experience, even by just talking, you should be able to calculate in your mind. It is not writing in the paper. We should be able to take that mini mental state examination in your mind itself, so that based on that only you will be able to proceed further. So it is not the ability to put it in the paper. First, it is the ability to use it in the mind. Okay. So what are the aspects? General appearance, speech, affect and mood, quality, range, appropriateness, all these aspects. So as far as the Mary is concerned, what is the presenting complaint? This is the presenting complaint. After the presenting complaint is written, okay, presenting complaint already we have written. This is history of complaint. After history of complaint, this is a transcript of the counseling session. Okay, what is the counseling session, and what is that they have come into the conclusion, and what is that we have applied. Okay, what is the therapy that we have applied? Applications, here CBT is used. I will send all these aspects to you so that you will be able to just read through it and you will be able to understand the various aspects, okay, which we have listed here. That is introduction, history of presenting problems, and past psychological history, and past medical history, family history, personal history, then mini mental state examination, physical examination, summary and diagnosis, formulation, and then the management and the summary. Okay, so all these aspects we will see in one more case history. Okay, we will see in one more case history, and before that, can you people take a paper and pen? Paper and pen, paper and pen, and can you people come on the video? Just 15 minutes more. Only 15 minutes I will take. Is it okay? Take a paper quickly. Take a paper. Take a paper and take a paper. See, one of the aspects is, so the first one is, we have to give the introduction. In the case history, introduction, giving the introduction. In the introduction, what are the aspects necessary? That is name. That is, we should not give the actual name. Okay, even Mary is not an actual name. We have to give some other name. Age, marital status, occupation, and referral details, and central problem. These are the aspects it should contain. Okay. Please mute your calls. Now, so this is what we will be writing. Now, this is what the introduction. Julie, a 25-year-old single accountant and a practicing economist, lives with her retired parents.
Sir, 1 minute. Please do it in the presentation mode so that it's visible.
Okay.
Thank you.
Is it visible?
It is, but it is actually in the, yes, now it is fine. Thank you.
Yeah. So the first one is name, Julie. Okay. The second one is age and marital status and occupation. Julie, 25-year-old, single accountant. Okay, she is single accountant and a practicing economist, living with her retired parents. Okay, she was referred by her family doctor with an abrupt onset of psychotic symptoms. This followed 2 weeks of lowered mood after the breakup of her first ever relationship, which was with a co-worker who unexpectedly left to travel to overseas. Okay, now the introduction. So introduction, it should contain all these aspects. Okay, now name, age, marital status, occupation, referral details, this will be very easy to write. The central problem which we have to indicate. Here, the central problem, it is indicated here. She was referred by her family doctor with an abrupt onset of psychotic symptoms. This followed 2 weeks of lowered mood after the breakup of her first ever relationship. So what is the aspect, central issue, and what may be the reason? Suppose if it is counseling, okay, we know the reason, we can write. For if we do not know, we need not write it. Okay, so this is the first aspect. The second aspect is the history of presenting complaint. Here we will be going a little bit at deep. So this should be the detailed account of the patient's central problem that you have already identified in your opening statement. So in the opening statement, already we have written the central problem. Put details about the problem and related symptoms in a chronological order, as this will help with the clarity of your writing. So you will also be able to understand. When somebody reads your aspects, they will also be able to understand. And this is the example. Okay, this is the example. Okay, so before the example, we have to understand, identify the common psychotic symptoms. If you are into clinical psychology, always a DSM will be very, very useful. So we must know the various aspects. Unless and until we know how to refer to DSM and what are the basic difference between various aspects, it will be very difficult. So even psychologists, I will advise that go through DSM, even though it is not within our purview. For knowledge sake, it is better to read it. Identify the common psychotic symptoms, note details of the previous treatment, and integrate current problems and psychotic issues. Now, So this is what the history we will write. For example, the patient describes an 8-month history of anxiety symptoms. It is 8-month anxiety symptoms, which began 2 months after a car accident. This is a separate history. Okay, not that one. Okay. So she experiences apprehensiveness when out of her home, inability to cope up with anything out of the ordinary, initial insomnia and irritability, and she has withdrawn socially. So the presenting problems has to be written in the chronological order. More recently, she has had trouble concentrating on her work. Then 5 days ago, she was taken to her local doctor after experiencing a typical attack in the supermarket. She has become housebound since, ruminating that I am terrified of suffering a heart attack and dying suddenly like my mother. She has begun drinking up a bottle of wine a day in an effort, she says, to calm myself down and make things more easy. Okay, more. So this is how the history of the presenting complaint we will be writing in a chronological aspect. Okay. Now let us try. Suppose somebody is coming with a. Yesterday I have told one aspect. Okay, that is if somebody is having fear of enclosed places. What is that called? What is that phobia is called?
Claustrophobia.
Claustrophobia. Yeah. Now a person is having a person is coming to you. Okay. Suppose I am that person. Okay. I am that person. Okay. I am that person, and you will be asking me the questions, and I am telling. Okay. See, actually, nowadays I am not able to just be in the enclosed things. I don't go to when I go anywhere. If I am alone, I get fear. Immediately, my hands starts shivering, and sometimes I get panic attack also. So I don't join any family gatherings. I don't join anywhere. So it has become a problem for me. Now, if at all you want to write an introduction, see, my name is Shiva. My name is Shiva, and I am 46 years old. For the last 2 years, I am having this problem. I am not able to take part in any kind of functions. I do not know why, but the moment I go, when I am alone or when I am in the social gatherings, I start feeling, I feel very terrified. And 2 times I got panic attack also. So, so that I have come to. Okay. Now for this, the initial aspect you will write. How you will write? Please, 3 minutes time. Okay. The initial aspect, the introduction. The introduction should consist of name, occupation, and the other aspects. So I am Shogmar, and I'm working in a forest ministry as a clerk. I'm working in a forest ministry as a clerk. So can you people write? 2 minutes time.
Yes.
2 minutes time. And what are the aspects it should contain? These all are the aspects it should contain. Name, age, marital status, occupation, referral details, central problem. Okay.
Sir, chat is disabled. Can you please?
Yeah, definitely.
Thank you, sir.
Right. We will see. See, people will write. I request people not to write anything about the judgment about how they are right. Okay. Even I am not going to do it. Okay. So you people also please don't do it. Okay. Because the moment we all want to play only the boss role, big boss role. Somebody starts writing something and immediately people tell, this is not correct, that is not correct. Okay? Nobody will put anything. Even I will also not put. I will give just suggestions. That's all. No judgments. Yeah. And if you want to ask any questions, you can ask me so that you will be able to write it. You can ask me questions.
Sir, please say something about banner. Become certified school counselor.
Sir, please ask about this particular case history which people are asking. People are writing.
So just to have an idea, Shola here, for last how many years were you unable to sleep? Shola here.
Yeah, Shola. This already I told. So any information which I have not stated, because active listening. Active listening. That is why. That is what I am checking. That is what you will also know. Okay. Any information which I have given, which you are not able to do it. So we will be able to understand where and all we commit mistake. Any information which I have not told, which people can ask.
What's your marital
status?
status?
I want you to write completely. See, I want you to
status is not new.
I want you to write. Meenakshi, 1 minute. I want you. It is not central problem, mood disorder, anxiety. No. I want you to write the complete aspect. Today, so and so came, and his age is this. The introduction part, no? The complete aspect. So I have not given the marital status. So you have to ask. So that is what Ashya has asked. Married. So let me see in the running letters how many of you are able to write a paragraph. In case history, you will not be writing like this. Nah? You will write a para, a small para you will be writing. You will not be writing like bulletins. Nah? It is not a PowerPoint presentation, isn't it? Your case history is not a PowerPoint presentation. You will be writing a small paragraph. Let me see how many of you are writing the paragraph. 2 minutes time. Two minutes time, the complete paragraph. So this was the introduction which we have seen. Julie, a 25-year-old single accountant and a practicing economist, lives with her retired parents. She was referred by her family doctor with an abrupt onset of psychotic symptoms. This is followed 2 weeks of lowered mood after the breakup of her first ever relationship, which was with a co-worker who unexpectedly left to travel overseas. Now, this is what we will write it in the introduction. Okay. This is what we will write it in the introduction. Okay. I want you to write the para. You have to change the name. Someone has put the name Shokumar. No, you should not. See, Archana has written very clearly. Client, yes, that's all. Yes may refer to Saxena. Yes may be Siva. Yes may be Sri Dhanajayan. Anything can be done. Client A, yes, aged 47 years old, married and working as clerk in policy department. Is self-referred with the chief complaints of not being able to attend social gatherings and has isolated due to panic attacks, feeling nervous, lack of sleep. lack of sleep. Extraordinary, super. Now this is what required. Saugat Shrestha Shiva is 46-year-old man. Super. Saugat Shrestha, absolutely fine. Super, great. Now, whoever is not written, just read this, whatever people have written. Okay. Hafsa, very nice. Super, Hafsa. Great. That means we are all very good. I have only 5 minutes. I will just go through. Okay, team, just come to the presentation. I will just show you one more presentation and then we will end the session. One more presentation. There is one case study. Okay, one case study on claustrophobia. Just I will go through it. And finally, I will ask the question also. Okay. So claustrophobia. So the socio-demographic data first. Okay, these are the socio-demographic data. Name, age, marital status, married, gender male, occupation businessman, education graduation, BA economics, religion Hindu, mother tongue Bengali, location of residence Kolkata, West Bengal, socio-economic status. This is very, very important. Middle class, informant brother, reliable and consistent. Now, according to client. Now, when we say the introduction, one is we can tell according to the client and what informant states. Because sometimes the client says, will say that I don't have any problem, but the informant will say that he is having so and so problem. So whenever I am in crowd or I think about being in crowd, then I feel uneasy and get sensation of cold feet and hands. I feel like I will die. I have problem to be in closed places like lifts and planes, but I also feel anxious when I am alone at home. Okay, so this is according to the client in his own wordings. Okay, you can see here no technical jargons I have written. Okay, the informant states his condition is causing a lot of distress to his family and they are ready to do anything to get him treated. Okay, then the history of the present illness. Okay, the history of the present illness. So the history of the present illness we will be giving very elaborate. Okay, very elaborately we will give. So this is very elaborately it is given. Okay, just I don't want to read this. I am sending the same PPT. You can read it. So it has the history states. What is the issue? 5 years ago, the client had started showing symptoms of anxiety and panic attacks. He would have such attacks when he is in a closed space or is alone at home. He would experience racing hearts, cold hands and feet, chest pain, difficulty breathing and palpitation. He thought he had a heart problem. As a result, he had many physical examinations like ECG, etc. But everything came out normal. He had gone to many doctors for treatment, including homeopathy and naturopathy, etc. 6 months back, when he was alone at home and fainted in bathroom after panic attack. As a result, general physician advised him to see a psychologist. He has traveled all the way from Kolkata to see a psychiatrist. Since he is afraid of traveling in plane, he came by train, whereas his brother came by plane. He feels that a lift will be closed and he will be stuck in lift. He also experiences anxiety before sleeping and living fear that he may have attack anytime. As a result, he feels stressed and restless most of the time, which is causing a lot of distress to family as well. He is the only breadwinner of the whole house. He has done treatment from many doctors, but nothing helped. So then we will be taking the details. Okay, the mode of onset, insidious, course of illness, fluctuating, progress of illness, static, duration of the illness, 5 years, predisposing factors, being in closed places or alone at home, limiting factors when patient goes to open space, deep breathe, rub his hands and drink water. Associated disturbance, lack of sleep, restlessness and stress. Perpetuating factors, anxiety and psychological factors. So, what is the past psychiatric medical history in treatment history? Patient is currently not taking any medications, but in the past, he had gone to many doctors to treat his physical symptoms, but nothing had helped him. Biological functioning, sleep. Client is not sleeping well for the past 2 weeks. Appetite normal, energy active. So negative history, there is no negative history of heart disease, high blood pressure and diabetes. Now family history. So the client's mother is a principal and his father has retired from his business as he is not keeping well. He has 2 elder brothers and they share a good bond. The client has a son who is pursuing his higher education from USA. Then birth and development history. Since both parents were working, he was alone after school hours. Behavior during childhood. The client stated that he had always been anxious growing up. He used to worry a lot going to school and exams and would not be able to sleep and eat properly. He used to be introvert child and had trouble talking with strangers. He described himself as a shy person. He didn't have many friends, but he shared close bond with few people. Academic history. Client is graduate. He didn't have much interest in studying. As a result, he joined his family business after UG. He liked playing cricket when he was in school. Sexual history, comfortable. The pre-morbid personality. That is the client history. The client is introverted and is anxious person. He is spiritual. He has a difficulty bonding with people. Then, the mental status examination. The mental status examination, as far as these kind of aspects, it is taken in depth. So the general appearance and behavior. Appearance is neatly dressed. The client has touch with his surroundings. The client has touch with his surroundings. Very important. So gait and gesture is normal. Rapport could be established and has a positive attitude towards examiner. Movement behavior. The psychomotor movement is normal. Speech is normal. The intensity tone is normal and productivity is also normal. The client's speech is coherent when he is talking and goal directed. Rate of speed is normal and there is no pressure or poverty of speech is observed. So subjectively, what is that he is talking? I am worried. Objectively, the client is concerned about his health. The depth and intensity of the affect is normal. Mood is observed as congruent to the thought. See, the mood, the thought and the behavior, it should be congruent. If it is incongruent, there is a problem. Mood is observed as congruent to the thought, communicable and appropriate to the situation. Thought. Content, the client had a preoccupation about fear of closed places. Perception, no perceptual disturbance is seen from the client. So the what has been done, the cognitive function. The client is oriented to time, place and date attention. Concentration is aroused and sustained. Memory, immediate memory intact. Recent memory intact. Remote memory intact. Abstractions, similarities adequate. Differences adequate. Proverb adequate. General fund of knowledge adequate. Judgment, personal intact, social intact, and there are no issues. So judgment, personal intact, social intact, test intact. What is the insight and what is the diagnosis? The patient was diagnosed with claustrophobia. The patient exhibits symptoms of hot flashes, panic attacks, tension, sweating, nausea and fainting. Here we will be using the technical term. Treatment plan. The client was prescribed medicine to reduce the symptoms of anxiety. That is because he is a psychiatrist. He was advised to start psychotherapy with a counselor. As soon as possible, doctor advised him to come again after 2 weeks. So he was given thought record sheet. And this is the thought record sheet which is being used in the CPT. Now treatment plan. The treatment plan is to give exposure therapy to client after a couple of sessions. It is a type of behavioral therapy that is designed to help people manage problematic fears. Through the use of various systematic techniques, a person is gradually exposed to the situation that causes them distress. The goal of exposure therapy is to create a safe environment in which a person can reduce anxiety, decrease avoidance and dreaded situations, and improve one's quality of life. Here in the treatment plan, what is that we are going to do, and what is the evidence for doing that? So what is that? What is the plan? The thing is do systematic desensitization and exposure therapy. So how it is done? He is trained in Jacobson progressive muscle relaxation. He was trained in wristband technique from CBT to bring him into awareness. Put a rubber band, and whenever he gets fear, he will just lift the rubber band and remove it. When it hits, he will get the consciousness. That is, he will not be under the subconscious or unconscious elements. He was trained in 1 minute mindfulness. That is, stop, observe, breathe, complete breathe, relax. That is 1 minute mindfulness. Client was walked through visual aloneness few minutes. So the client was made to sit. He was given a relaxation exercise, and he was taken into a visual aloneness. That is, visually he was taken into a place wherein he was sitting alone, and the behavior, the body language, everything was observed, and it was given frequently 2 or 3 times, so that visually when he was seeing himself alone, he was not having any negative aspects. When he is not having any negative aspects, when he visually seeing himself alone, then physically he has been moved to the, he has been given to the exposure therapy. So before exposure therapy, before systematic desensitization, visually we will make him ready for that. The client was told that he will be left in the counseling room for 5 minutes, the next session. So hit a wristband every 2 minutes. So you will be alone in the counseling room. Hit every 2 minutes. To come to mindfulness, then do 1 minute mindfulness meditation. He was asked to do relaxation exercise. That is Jacobson, he was trained. When he starts feel anxiety. So he will be alone in the therapist room, and he will be just doing this. The moment he feels a little bit of uncomfortableness, he will do the mindfulness exercise. And suppose if he feels too much, immediately he will be doing the Jacobson relaxation, because it is having the physical body also. So when you relax the physical body also, the output will be better. Then initially the time limit in which in the counseling room he was there for few minutes. It was for few minutes. If you can see it here, it was for few minutes. Then the time limit was increased to 3 minutes, 4 minutes, and 10 minutes. He was given homework and do thought record sheet, and he was asked to work alone in the kitchen and write all the aspects which is coming in the thought record sheet. Meeting after 2 days. Summary: the treatment helped the client to come out of the phobia slowly. After 3 sessions, he was able to go alone to places to help him with the relapse prevention. Meeting fixed after 2 weeks. All these aspects we will be writing in third person single. Very simple. Okay. So intact means clear. He is okay. Intact means he is okay. Okay. So team. So this is what the case history. Okay. The 2-day seminar in which the webinar in which we have taken about the aspects. Whether you got some idea about writing a case history. So I will end the program now, okay, with your input, and then I will tell you how to, what is the process for taking the certificates. Yeah. Archana, these are the aspects we will discuss in the next side talk. Anything related to case history, anything related to case history, we will discuss. So any doubts, and can you people come on the video? I will take a snap. And whatever your doubts, maybe you can post it in the group also. If you have any doubts, you can ask now also. How to take the certificate? Okay, the certificate is absolutely free. Okay, we are not going to charge anything for the certificate. Okay, but we will not be giving certificate just like this. Okay, I will be releasing the Google form tomorrow. I will be sending the Google form tomorrow. Okay. In the Google form, you have to fill all the details. Write your name completely. We will not put Mr. or Mrs. We will not put. Okay. We will not be having any Mr. or Mrs. Whatever the name which you are giving, we will be putting it as it is. Okay. That is one thing. The second aspect is we will be your photo will be there. Okay. You can send a very nice photo. Okay, for the certificate. Now, the activity, the project which you have to do is, okay, case history format. What is the format of the case history? Okay, which already I'm going to share you also. I want you to record it in the video. Okay, you can record it in your mobile also. Okay. Hi, team. I have attended the 2 days webinar on case history conducted by Global Trainers, Counselors Organization and Emocare. The format for case history is introduction. Can anyone tell what will come next? What will come next?
History of present complaint in chronological order.
So the format contains history of presenting problems, past psychotic history, past medical history, family history, personal history, then mini mental state examination.
Personal.
Yeah. So all those aspects, just I want you to record it, and of course the feedback. Then you can complete it with the time, because we want to know that at least the format it is intact with you. Okay, which I want you to send it to this number. Okay, I'm sending the number. I want you people to send to this number 7010702114. Okay, 917010702114. Okay. Now, if you send a case history, remember clearly, only the video is mandatory. Okay. Suppose even in the way in which we have shown you the case history, like that, if you share a case history, we will put it in the certificate that for evaluation, the candidates had submitted a case history, and that has been evaluated. That also we will mention in the certificate. Provided you submit. When you submit, our people will go through it, and we will just tell you what are the, if you have any mistakes. And these all are the things only Emocare does. You cannot see it anywhere in India. Okay. So these are the aspects. Recorded
I have a doubt.
Yeah.
Sir, can I?
Yeah.
In that case history, do we have to put on story, or we just have to describe it what it is?
Yeah, that is what the full case history. Case history means, see, I'm showing the case history. One case history I will show you now. That I have already I have shown you the word file. One more time I will show you.
Do we have to do it on that, or we can make some of our own?
No, your own. See, you can take your own. You can see, always for study, we create something hypothetically. See, first hypothetically you have to create and you have to put it. Then only you will be able to do the actual aspects. So like this. See.
Excuse me, sir.
Yeah, 1 minute. So this is what. So the transcript and what is the problem and what is that she was given the treatment And what is that we have applied? That is application of CBT. Yeah. Now, there is sending the case history not, sorry, sending the case history is not compulsory. Only video you can send it, you will get the certificate. In the certificate, if you need a word, if you need a sentence that the candidate has submitted a case history for evaluation and it has been duly evaluated. If you need this, if you need that sentence, I want you to write the sentence. Okay. Now I'll be sending the format. Please give us some time. Okay. We have many training programs which are coming. So we will try to give the certificate as quick as possible. Okay. Because we have our next program coming. Okay. Next program coming. And all the PPT, everything, it will be shared in the group. The
Excuse me, sir. Excuse me.
Yeah,
Sir, will you send it in the group?
yeah.
Okay, sir.
I'll be sending everything. Whatever we have discussed, whatever. One minute. Whatever Rati ma'am, Dr. Rati ma'am discussed, that I will share it in the group. Whatever I have shown you, that also I will share it in the group. And I will share with you some examples of the case study also. I will share it in the group. Okay. Yeah.
The case history can be about any situation, right?
Yeah, any situation. You can create a hypothetical situation also. And we will also give some of the situations.
So we can only take one.
Sir, can you send the video format also? How can we proceed for the video?
Video simple. Video is very simple. Video is very simple. Just tell your name and your place. And I have attended the 2 days webinar training on case history. And the case history contains the following aspects.
Okay.
So introduction, right from that, just a talk. So these are the aspects which we have learned, and I am able to do a case history now. Then, if at all you want to give any feedback about the session, 2 seconds. Thank you. You can end it.
Okay, sir.
Very simple. Very simple. So, team, the further programs which we are going to conduct, I will update you. Okay. The first updation is next month, 25th. We are going to start with. Mental health advocate, and supporter. It is a 15 days training program. Our mission, the mission of Rati ma'am and Vanitha ma'am, can you just join me in the video call? And Emocare team people, the aim of Emocare is to create minimum 10,000 mental health advocates and supporters all over the world this year. This year we have taken our mission is to create that. And for that, the team which is working is Dr. Vinita, Dr. Vanita, and Dr. Rati Chandana, Tabasam Suleiman, okay, Kavi Menaga, they're all from my Emocare team. Tabasam Suleiman, can you say a hi? Can you say a hi?
Hi everybody.
Can you say a hi? Can you say a hi, Kavi Menaga? Kavi Menaga is from Emocare. Dr. Vanita is from Emocare. And we have Fatma, we have Preeti, Dr. Gauss. Anyone from Emocare team, kindly join if you are there. Okay, on the front screen in the video. So 15 days program which we are going to start. Okay. I request you people to join. Okay, you people to join, and I request you people to refer this to your friends. If you are studying in a college, please share this information with your college principal. Okay.
So what will be the timing of upcoming program?
The mental health program, that will be 9 p.m. to 10 p.m. Okay. We are going to conduct in Hindi and Tamil also. It will be conducted in Hindi, it will be conducted in Tamil, it will be conducted in English. Okay. And this is one program, a free program which we are going to conduct.
I can help in, sir, I can help in Punjabi also.
Yeah, that's great. That's great. That's great. So this is what we are going to start. The one more program which we are going to start is school counseling. If you are interested to become a school counselor, or if you are interested to work in school as a school counselor, or you want to do business in schools, okay. It is a paid program. It has a child counseling, mobile addiction, how to come out of the mobile addiction, and school counseling. And we are not just training, we are doing the work in schools. For the past 7 years, I am working in schools. In whatever areas I have told them, we are actually working. It is not that simply I am referring to the book and I am showing the PPT and taking the training program. No. You can just visit my YouTube. In my YouTube, there are more than 1,000 videos, not 1 or 2. 1,000 videos we have, the training programs which we have taken in schools, corporate companies, and colleges. Okay. So, school counseling, we are having first-hand experience of counseling students and teachers and the non-teaching staff. So, the school counseling, which consists of school counseling, child counseling, and mobile addiction, mobile and internet addiction. The 3 aspects, the 30 days program, 30 days a certified program, and our training is certified by CTTA. That is Complementary Therapist Affiliated Association. It is certified by them. And we are the only people who are having such a affiliation in India, along with some other, there are 3 more organizations. 3 more organizations which they have. Thank you very much, team. Our number is 69962163122. And Kratika is from Netherlands, and she is also from Emocare. You can say a hi, Kratika. You can say a hi, Kratika. And that is Vanita ma'am, you know it, and Rati ma'am, you know it. Dr. Vanita and Dr. Rati Chandra, it was a wonderful session. It was such a wonderful session.
Thank you so much, sir.
Thank you, sir. And we are always at the service. Emocare, we'll work for Emocare. We are always at the service.
Thank you so much, dear audience, for sparing your valuable time with us. And I hope we all would have been able to give you some information. And we all are with the mission and vision to help the society on a common grounds. So do join our community if you feel like that you have the same mission and vision. Thank you so much.
Thank you, Rati ma'am. In spite of actually, Rati is a person who is always traveling. Whenever I ask, she will say, sir, I am in airport. I am in Bangalore airport. I am in Amritsar. Okay. Always she is a person who is flying. Okay. So thank you very much for sparing your valuable times. Dr. Vanita, thank you very much from the bottom of my heart for sparing your time. And thank you very much, participants. You are all great. You are all great. Why you are all great? Because it is already nearing 2 hours and still we are having 67 people. Thank you very much, team. And I'll be sharing the Google form. Okay, I'll be sharing the Google form. Any one person, if you are able to give the feedback of today's session, I will be very happy. The 2-day session which we have taken, if any participant, if you are able to give oral feedback, we will be really happy. Anyone?
Yes, Shola here.
Yes,
It was an amazing session, sir. It was really very, thought-provoking and giving a lot of information, lot of insight into something new. It was, really a very learned session. I mean, we learned a lot. A big thank you to all of the team and all of the members. Thank you so much, sir. Thank you. So I think also there was this bipolar session that was to be included, right?
Yeah, actually I had 5 aspects: bipolar and post-marital counseling. Okay, I have created everything, but it is already 7 o'clock. Maybe next side talk, I will share everything to you. Team, I have shared my Google page. Already we are having 1,905 stars. If you like this program, please visit there and write something. Write something and bless us with your 5 stars. We will be very happy. The link is there. I think I have introduced all the Emocare people here. Thank you very much.
Sir, one request. Can you please
Amazing
share
team.
the Google page that you've shared here and the upcoming session details in the WhatsApp group as well?
Yes,
Yeah,
sir.
yeah, group. Yeah,
That would be
actually,
helpful.
everything will
That
be
will
in
help,
the. Actually, everything will be shared in the group.
Okay. And sir, just one more thing I want to add
Yeah.
to the feedback is few of the sessions that we've attended in the past has been more on the theoretical, but here it gave a lot more information about the practical on ground level reality. So that's something I wanted to add to the feedback. Thank you very much.
Thank you very much, Archana. Actually, Archana, we have planned to write the complete history. Okay, that we will do it on the next Sunday, if time permits. Okay, because see, if I write it here itself, okay, other people can correct. See, always we need people to correct now. Nobody can be will be able to write perfectly on the first time itself. So, if time permits, we will do one more session. So, the mental health ambassador, kindly refer to your friends, kindly refer to your students. There are many people from the college, professors are here, lecturers are here. You can share this information and anyone can participate. Psychology, there is no need that only psychology students need to participate, because somebody is trying to, somebody is having a thought of committing suicide. To whom they will tell first? They will tell to some friend. The friend may not be having any psychology knowledge. Now we want to educate everyone on the basic psychology so that the friend knows what is to be done. Psychological first aid. Psychological first aid to be given to that person. For that we are trying. One more thing, 17, we are having at present 8 counseling centers. 8 franchise we are having. We are inviting more franchise. If you would like to work us, and if you would like to become a part of Emocare by taking a franchise, we welcome you. We will definitely, we are having so many projects in the coming years. We are really going to change the way in which the mental health system functions in India. Really, we are going to create an impact on the society. And we request you people also to join on the history. Please rate it, and thank you very much. Thank you very much. Bye bye.
Thank you, sir.
Thank
you.
Sir, I was missing your singing.
मुस्कुराते हुए.
Thank you, sir.
Thank you, sir.
Thank you so much,
Thank
sir.
you, sir. Thank you so much.
Thank you so
Bye-bye.
much.